Hello, my name is Lucien, and today I'm going to be talking about one of our DRI projects, MCH, or Maternal and Child Health Coalition. And so first, I want to give a little bit of background on who they actually are. And so the MCH Coalition is an advocacy group made up of over 100 diverse stakeholders in maternal and child health in New Orleans. And so their members include researchers, healthcare providers, doulas, and other individuals who are employed by state and government officials or local state government officials, as well as representatives of community organizations. And so their main goal is to create public health solutions for and by providing direct services to New Orleans families during the prenatal period. And so one of the main things about this project just is about their core values. And so their number one core value is that they believe that healthcare is a human right and should be equally accessible to all. And so once again, the MCH Coalition works to improve birthing access for all birthing people in New Orleans. And so now I'm going to tell you a little bit about the work that the DRI team has been doing for this project. So the MCH Coalition has provided us with data, and so we are working on creating different visualizations so they're able to get across the points that they are making for the different peoples that they serve. And so I'm actually going to go ahead and share my screen so that we're able to see some of the products that we have. And once again, this is not a finished product, but it's almost there. And so we have leveraged Tableau to create a distribution of the mapping to show just the different kinds of healthcare disparities there are. And so, for example, we have information about the different districts. And so this kind of tells us the different percentages almost by year of what is happening. So, for example, we see in District 37, they have the percentages of like the low birth weight. They have like the number of births that were either by white people or by white people who give birth or by Black people that give birth. And they keep track of whether they were preterm, whether they had a low birth weight, and they are essentially just trying to see what kind of factors might play into different birthing outcomes. And then on our healthcare, so this is a map of the districts in New Orleans, and then the parishes in New Orleans. And then this is the map of the house districts in New Orleans. And so we can also see different distributions about their population, the median income. And then also right now you can kind of filter through if you don't want a parish or parishes that make a certain amount. And of course, this is going to be refined later to be a drop-down. And then you can also choose whether you want to see a specific year. So if you want the rates for specifically 2012, you could have all that information there about the income distribution, as well as the number of birth counts and percentages. And then another thing that we worked on was their history. And so we created a timeline where we were able to look and just transfer all of the information they had on an old timeline onto this new timeline. And so this keeps track of just all of their information, their history, starting from kind of 2017. And so this is something that we are refining and perfecting for them. And so you see we have links to different videos, and yeah. So that is what we have been doing for MCH. Thank you once again for watching this video on MCH and the products that we have produced this year for this client. And thank you.